In this video, I break down the 3 meta skills that helped me build over $3 million in my career, and it's only been just over 13 years without any digital advertising or marketing or ad spend. These meta skills cannot be learned by AI. In this day and age, AI is all the rage, and everybody is worried that AI is going to take over their jobs. And most of us physical therapists feel like we're immune to this because our job is so intimate and we have to use our hands. But I beg to differ because I've used some of these large language models and they're pretty darn accurate. They know all the jargon, all the lingo, and some of these technologies can actually assess movement and spit out a pretty accurate diagnosis. So what are these 3 skills that I'm talking about? Well, it starts with emotional intelligence. Emotional intelligence is a skill or a knowledge base that most physiotherapists overlook. And I was introduced to it when I picked up this book by the author Mark Brackett called Permission to Feel. He's got this ruler framework and it's pretty good. First, you recognize when there is an emotion, you try to understand it. Then you label it. And when you label it, it loses its power over you. Then you're able to express your emotions more freely and then learn how to regulate it. And I think this is so important for physios, physical therapists. I'm in Canada, so we call ourselves physios. It's so important because the therapeutic relationship is very emotionally driven, and we're taught to just kind of be robots and not express our emotions. But this can really lead to burnout, and I've seen it and I've felt it. In the past, I've taught sinister pathologies in some of my patients who I really cared about, and it was really tough on me. And as much as you try to keep that professional boundary, you learn about these people, and they're more than just pathologies, they're people. Another thing is when you're dealing with confrontational clients who have these unrealistic expectations, and when you don't fix them, they get very upset. And having to deal with all the different personalities in society can be really tough. In the past, as a younger therapist, when I look at my schedule for the following day and I see certain names on my patient list, you get this feeling in your stomach and it doesn't feel good. So once I understood how to improve my emotional intelligence, then it really helped a lot. It was able to give me more bandwidth and a longer runway. So that's number one. Number two is active listening. That's not just nodding your head while you engage in conversation. It's actually listening to what the person's saying and trying to decode it, because we like to beat around the bush and we don't really tell people how we feel. But if you're building that therapeutic relationship, if you probe a little bit, you'll get a better idea of why they're actually in your clinic, in your space. The other day, I was working with a woman who has an 18-month-old, and she had some pain before and during pregnancy and then hasn't gone away. She has seen so many people, and a lot of the education was around biomechanics, anatomy, a lot of fear tactic. And I asked her, I said, what would happen if your pain did not go away? Well, first of all, she started crying because no one has ever asked that. And then she answered with, well, I'm the only one that can really take care of my child. I don't have anybody else. What if something really bad is happening? So I said to her, let's hold on a second and let's talk about pain. So I had to educate her on the mechanisms of pain, a little bit of that pain science, so that she would understand that she's not broken and she's not just going to fall apart. I also empathize with her because I have 2 young kids as well, and I know how it is. If any of you parents have been in the trenches, it's not easy, and sleep is not something that you get a lot of. And when you don't sleep, you're not feeding yourself properly, you're not exercising and moving, pain can definitely be a problem for you, especially if you have an underlying problem or you're predisposed to pain prior to. So once I educated her on that and she felt safer, we were able to kind of get the ball rolling and figure out exactly what treatment plan is necessary to meet her goals of being a functional parent for her child. And the third one is communication. We communicate not just with our words, we also communicate with our body. And I think this is very important. In a therapeutic relationship, when you're engaging in conversation, you have to get at the same level because you need to be eye level with the patient. You don't want to be standing up and looking down, or you don't want to be down here while they're up there. It's got to be level. And it's so important to look into their eyes. There's a mentalist, Oz Perlman. He put me on this. Look into their left eye, because their left eye connects to the right hemisphere of their brain, which is more threat, safety detection, and emotional connection. So when you look into their left eye and you're not just scanning their body, they don't feel examined, they feel seen. This is a little trick that when I started to use it, I could tell people took their guard down and they really opened up. So body language and words. Words can actually create fear and increase somebody's pain. Here's an example. I think your spine is unstable. Versus, I think your spine is a little sensitive right now and we just need to try to make it feel safer. And it's possible. That is completely different. The fear tactic makes the patient feel really dependent, and actually it can exacerbate their symptoms. So we want to make sure that we calm them if we need to, or if we need to motivate, we can bring them up. Tone of voice is very, very effective. The use of your tone, intentional use of your tone. These are my three, let's call them meta skills, right? Because I don't think AI can learn these skills, and human interaction goes a lot further than you think. So if this resonates with you, please subscribe and drop a comment. I want to know what you think is the hardest of these three skills to develop, and share your own stories around this, because as a collective, I think we can have these discussions and improve our profession overall. Na, na, na,